Hi guys, welcome back to another YouTube video. Today we'll be talking about rabies in dogs and humans. So without any further ado, let's get right into it. Meet Shadow, a 3-year-old street dog who was brought to Ivor Clinic by a concerned local resident. Shadow had been acting strangely aggressive one moment, disoriented the next. He was drooling excessively and had difficulty swallowing water. After examination and reviewing his history, we suspected rabies, a viral disease with a 100% fatality rate once symptoms appear. This case reminded us why rabies awareness is critical, not just for animal health but for human safety. In India, rabies claims thousands of lives every year, mostly from dog bites. By the end of this video, you'll know how to recognize rabies, protect yourself and your pets, and what to do if you're ever bitten. So, what exactly is rabies? Rabies is a fatal viral disease that affects the central nervous system, the brain, and the spinal cord of mammals, including cattle, goat, dogs, cats, humans, etc. The virus is transmitted primarily through the saliva of infected animals, usually via bites or scratches. Key facts: once symptoms appear, rabies is almost always fatal. The virus can incubate for weeks to months before symptoms appear. India accounts for 36% of global rabies deaths. 95% of human rabies cases come from dog bites. Children under 15 are most vulnerable. The virus travels from the bite wound through nerves to the brain where it causes inflammation and devastating neurological damage. This is why time is critical. Treatment must begin before symptoms appear. Symptoms in dogs. The early stage, called as the prodromal phase from day 1 to day 3, show behavioral changes, restlessness and anxiety, fever, and excessive licking at the bite wound site. Progressive symptoms cause furious rabies from day 3 to day 7 include aggression and irritability, hypersensitivity, restless roaming, excessive salivation, difficulty swallowing, and hydrophobia. Critical late symptoms that causes paralytic rabies from day 5 to day 10 causes paralysis, dropped jaw, difficulty breathing, seizures and tremors, which then cause coma and ultimately death. In humans, the early symptoms include fever, headache, general weakness, discomfort or tingling at bite site, anxiety, confusion and agitation. Later symptoms include insomnia, hallucination, hypersalivation, hydrophobia, paralysis, coma and ultimately death. It is critical to understand that once symptoms appear in humans or animals, survival is virtually impossible. This is why prevention is everything. Main causes and risk factors. How rabies spreads. The virus spreads through infected saliva entering the body via bite wounds, scratches, mucous membrane exposure, and open wounds. Highest risk groups include dogs that are unvaccinated, dogs with outdoor access, dogs in endemic areas, and younger dogs. For humans, it includes children under the age of 15, rural populations that have limited access to post exposure prophylaxis, animal handlers, and travelers to endemic regions. Common sources in India: dogs 95%, cats 2%, jackals, foxes, monkeys 2%, and other mammals around 1%. In Shadow's case, he was an unvaccinated street dog who likely had contact with other infected animals in his community, a common scenario in urban and rural India. Treatment option. Here's the critical truth about rabies treatment. For animals, there is no treatment once symptoms appear. Infected animals will die. Suspected rabid animals must be humanely euthanized, strict quarantine protocols must be followed, and no cure exists for symptomatic animals. For humans, post exposure prophylaxis (PEP) is where lives are saved. PEP is highly effective if administered promptly after exposure. Wash the wound immediately, flush with running water and soap for 5 minutes, apply antiseptic, do not bandage tightly, and seek immediate help. The PEP protocol. At the Ivor Clinic, we follow the WHO recommended protocol, which includes wound assessment to classify the wound as either Category 1, Category 2, or Category 3, administering rabies immunoglobulin, followed by rabies vaccine series, and observing the bite-in animal. Cost and accessibility. Government hospitals often free or subsidized treatment, while private facilities show treatment for up to 5,000 to 10,000 rupees for the complete course. Time is more valuable than cost. Never delay treatment. Pre exposure prophylaxis for high risk individuals, including vets, veterinary students, animal handlers and wildlife workers, lab workers, and travelers to high risk areas. Prevention tips. Here's how to protect yourself, your family, and your pets. Number one, vaccination, the single most important step. For dogs, first vaccine at 12 weeks of age, booster at 1 year, subsequent boosters every 1 to 3 years, annual boosters recommended in high risk areas. For cats, same schedule as dogs, indoor cats need vaccination too. For humans at high risk, pre exposure prophylaxis and boosters every 2 to 3 years for people at high risk areas. Number two is animal population management. Number three is avoiding high risk behaviors. Don't approach dogs or pet unfamiliar animals. Do not provoke dogs. Do not allow children to play with unknown animals. Teach children proper behavior around dogs. Supervise child pet interactions and keep pets on leashes in public. Report aggressive or sick looking animals. If bitten or scratched, take immediate action. Wash your wound thoroughly with soap and water. Apply antiseptic and seek medical attention. Get PEP started immediately. Number 5 is education awareness. Number 6 is travel precautions. If you're in Rohtak or surrounding areas and need pet vaccination against rabies, advice on animal bite management, referral for PEP treatment, or education on rabies prevention, visit IAVIA clinic immediately. For our address and contact information, refer to the details presented on the screen. Remember, rabies is 100% fatal but 100% preventable. At IVA, we are committed to creating a rabies free India through education, vaccination, and community empowerment. Our BVSC and AH students learn comprehensive rabies management from diagnosis and epidemiology to public health strategies. Visit www.ivarindia.com to learn about our veterinary programs. Together, we can make India rabies free by 2030. So, if you found this video helpful, make sure to like, share, and subscribe. So, see you in the next video. Bye bye.